on sclerotherapy. The content is originally from Claudia. She works for HHT in the Italian branch, but she couldn't actually attend today, so she sent on the content. And Marie Ralphs from HHT Ireland is actually going to talk us through it. So I'll hand over to Marie now.
Hi everyone. I'm just going to give you an overview of sclerotherapy and its use as a treatment for epistaxis in HHT patients. It's not a brand new therapy. It's an old technique that was used for many other conditions. There was a lot of international buzz on sclerotherapy in social media, and then Spain shared information on sclerotherapy with HHT Europe Federation. In 2019, HHT Europe met with Dr. Sol Marcos. There was interest on behalf of all organizations, but there was also concern that there was no official reference to it anywhere. Then in 2020, the international HHT guidelines came out and they did contain a reference to sclerotherapy. At this point, HHT Ireland patients can avail of this treatment in some parts of Europe, and it will be covered by the European Health Card. If you're interested, HHT patients can contact HHT Ireland directly, and we can get you some more information. Sorry, just have to bear with me for a second. There's a screen shot there from the international guidelines that you're looking at on your screen at the moment. It refers to sclerotherapy among other treatments as treatments for epistaxis. You can see on this that the quality of evidence is described as moderate and the strength of recommendation is weak. But this is testament to the fact that there have been very few studies carried out, partly due to the rarity of HHT. It is also why Irish ENTs are so far reluctant to offer sclerotherapy. But the guidelines do recommend that clinicians should consider ablative therapies, including sclerotherapy, as possible treatments. The next slide, please, Michael. Here we have a map of where exactly in Europe sclerotherapy is on offer by ENTs. So many European patient organizations, as you can see, have no access. HHT Europe are working to change this situation with the help of all member organizations. So the next steps moving forward for HHT Europe, we are coordinating with ENTs across Europe to create a protocol for sclerotherapy, which will lead the way. Then we need to support our national ENTs to train once we have a protocol. Every organization within HHT Europe hopes to send someone to train. At this early stage, HHT Ireland is considering the possibility of a fundraising project to contribute towards the costs of sending an ENT for training. Our final goal is to have access in Ireland. This would ensure equal rights for all our members. No need to travel for treatments, as the expertise will be here. And HHT Europe hopes to have more updates on this topic in September 2022. Thank you.
Thanks for that, Marie, and thanks for stepping in at short notice as well. Fair play to Marie. She only found out last night that she had to tog out and cover these slides today. So thanks a million for covering that at short notice. And speaking of kind of covering for short notice, we had 4 HHT patients have been to the centre in Madrid and had sclerotherapy done. And one of our members, Idoia, had put together some slides, a presentation to present today. But unfortunately, due to a bereavement in her family, she's not actually able to attend in person herself today. So Dara has volunteered to actually share Idoia's journey. So in a way, it's Idoia's story, but it's Dara who's actually going to be taking us through it today. So I'll hand over to you there now, Dara, as well. Thanks.
Thanks, Michael. And there's a lovely picture of Idoia Dunbar. Idoia is actually from Bilbao and came to Ireland, came to Wexford 30 odd years ago and fell in love, and the rest is history. But Idoia brought HHT with her. So all credit today for this project goes back to Idoia. This is all her work today. I'm not taking any of it. I'm just the middleman. So welcome to the band of bleeders. Next slide. The band of bleeders we call ourselves. Welcome to the Band of Leaders' journey to Madrid to receive sclerotherapy treatment for epistaxis. Let me introduce you to the 4 people who made this journey on the 18th of February 2022. The Band of Leaders we call ourselves: Darren, Janet, my son Saoirse, and myself, Idoia. Idoia's there on the left. We met Darren and Janet for the first time at Dublin Airport. They didn't know each other either, but HHT and our shared stories created a friendship among us. This was the second time for Saoirse and myself. We had organised our first trip through HHT España and Dara Woods back in November 21. We all travelled on Thursday, the 17th of February with Ryanair, and we returned on Friday evening the very next day. Alcorcón is about half an hour by taxi from Madrid Airport. There is easy access by public transport too. We stayed in a hotel with restaurant and shop facilities close to the hospital. We used taxis and public transport to get around. I can give further information about hotel and transport to anyone who decides to travel to Madrid for sclerotherapy. The Hospital Universitario Fundación is in Alcorcón. Now, by the way, we have 1 or 2 people from Spain with us today, so please forgive my Spanish pronunciation of that hospital. It's absolutely essential you bring your European health card with you and ensure it is also up to date. You can get this from the HSE. To speak of sclerotherapy in Madrid, I must first mention our guardian angel, Dr. Sol Marcus. She is the ENT that administers the treatment. She is a warm, caring, dedicated, professional and unique doctor. She has HHT clinics on Thursdays and Fridays in the hospital. Alcorcón is in the outskirts of Madrid. We met Dr. Sol on Friday at 9 at the hospital. She's bright, cheerful, young lady who speaks pretty good English. Next slide. The ENT department is on the 2nd floor of the very busy hospital. Outside room 17, there's a HHT sign indicating that you've arrived. Sol, as you can see, has 4 little trays with what she needed for each of us, with our names on each one. She had never met Janet or Darren before. Next slide. Sol has a tray with all her instruments laid out, and she places a light around her forehead to have good visibility up into the nose. Sol works through patients in rotation. We take it in turns to sit on what we call the hot chair. One patient is being treated while the others wait. Treatments are short and repeated, as it can be slightly painful. The atmosphere is dynamic and supportive. We all encourage each other. Passing medical staff are very nice too. The room has access to 2 other treatment rooms. Let's not forget that this is a very busy hospital. There are 6 stages of the process. Sol explodes the nose for telangiectasias and applies cotton wool wet with local anaesthetic into both nostrils. This is done to each patient one by one. The next step is after 10 minutes, she injects the substance etoxysclerol into each telangiectasia of the first patient. She does 1 telangiectasia at a time. She does not do all the telangiectasias in a go. The patient then gets more local anaesthetic and waits again for his turn to get another telangiec done while the next patient is being treated. She recommends the sclerotherapy is done when telangiectasias are small and bleed at least 3 times a week. So that might cover a lot of us. When Sol is satisfied that all telangiectasias are treated, she inserts a dissoluble gauze into the nostrils. Then Sol gives every patient a written report of what treatment has been done today on each nostril and some antibiotic. Next slide. Finally, the patient goes to the hospital pharmacy at the end of the rainbow ceilings on the ground floor for a free small jar of propranolol cream to apply from then on to each nostril. On our trip, we were very kindly visited by the president of HHT Spain, Mr. Martin Jimenez, and 3 other lovely HHT patients and members from HHT España's patient organisation. Next slide. The rest of the day, the nose drips as if you had a cold. This will last a few hours, but you're all well enough to enjoy the afternoon in Madrid and fly home afterwards. We were finished by 12:30, so we travelled to Madrid centre by train and spent a very warm and sunny afternoon having lunch in La Plaza Mayor. Darren even got time to visit the museum. So on the next slide, we're going to read some of their testimonials. So here Idoia said no insignificant bleeds. Janet, who's with us today, said, I'm delighted I got sclerotherapy done. Can't wait to go back. I had a few heavy bleeds that only lasted 10 minutes, where I would have bled for an hour or so before sclerotherapy. It's definitely worth getting it done. Saoirse said, both times I started bleeding a little, a couple of weeks after the procedure. I went back 3 months after the first treatment. However, at no time have I been bleeding as much as I used to, and the procedure is the only thing that has worked, and it has given me huge relief. While it's not a cure, I feel it has given me my life back, and I'm not worried about bleeding anymore when I'm out on social events. I also used to bleed a lot at night, but since the first sclerotherapy last November, I have not had any nosebleeds at night, and most bleeds have been quite small. And finally, Darren, who's with us today also, my bleeds are greatly reduced. I get 2 days of 10-minute bleeds and then 4 days of no bleeds at all. Now, we can appreciate that was last November, so we will get an update from Janet and Darren later. Back to Idoia's slide, the next slide, she said, so we have made a few videos of each of us having the treatment. We advise you look away if you're squeamish. We're going to show these very short clips. So if you're not into this, this is your time to leave the room. But Michael is going to play. It's the first one up is Darren.
So we don't have to take care of it. Do you want to have a look? Do you want to have a look?
I'm not squeamish.
That's good.
But very little. Just this one there.
Had
Good. You see enough of them in your life?
You can
one
click
of those
here.
days after I got more concerned about the needle that I'm with.
Do
We
you
have
have after effects?
Several lesions there. Which side is your worst?
The right side.
The right side, yeah.
I was having a colonoscopy done a couple of years ago.
Yeah.
We are going to start with the right
I
side.
told them I wanted to be asleep. Obviously.
Yeah.
I woke up in the middle of the
Oh,
night.
no. Oh.
And it was right side.
Hola, Martín.
Good morning.
Okay, good morning.
Okay, so I'm told that the white tissue on the mouth is for biting down on if there's a little pain. It's not to catch blood or anything like that. It's Darren will tell us more. So back to Idoia, she says, so if you would like to become a member of our band of bleeders, don't hesitate to contact HHT Ireland directly for more information on sclerotherapy. Many thanks for your time today, Idoia. So that is Idoia's slide. I'll hand you back to Michael there.
That's fantastic. So thanks a million for that. It's great. In a way, when you see the hotel you're going to stay in, when you see the doctor, when you see how the treatment is actually done, and it almost looks like it's been done in a dentist chair. It's not exactly like you're out on the flat of your back. It kind of takes some of the mystery or some of the fear out of it. So it's great that the guys kind of went ahead and that they brought back some great storytelling materials for us, both the videos and the photographs, and of course Idoia's commentary there that Dara read out. So that's fantastic. I suppose we mentioned previously that we would have an open discussion as we got towards the end, and that we would stop recording for that piece. So sorry, Dara, did you want to jump in?
We might invite Darren to speak first, and then Janet, just to give us the update how they are since February. Maybe you'd invite them.
Perfect. Yeah. Darren, did you want to go first? If you just unmute yourself there, you'll be able to share your story with us.
Can you hear me okay?
Can indeed.
You can? Yeah. Yeah, my name is Darren. Regardless of what you see in the corner, I seem to have up into my wife's Zoom as opposed to me. Thank you very much for doing that. I didn't want people to think I was pre-opping or something like that, because if this was the result, you'd want your money back. Yet sclerotherapy has been absolutely fantastic. It's the best treatment I have had so far. I've had laser for the last 2-3, maybe 3 years. I've had laser, and I always got some relief. I got relief, kind of 1 year, 6 months, that kind of thing. So it's kind of it decreased obviously as it went along. But sclerotherapy was absolutely fantastic and has been fantastic. The thing about the mouth and all that, I think the grimace on my face in those videos makes it look worse. I think it was more kind of the anticipation of what was to come, but it's not that painful at all. It's no different to getting an injection when you're getting your teeth filled or whatever the hell. But that's even decreased because your nose is anesthetized previously, and that also starts a little bit of bleeding. But that's natural because that highlights where the bleeding spots are. So that helps Saul as well. I was only talking to Saul yesterday, and I was telling Saul about this today, and she was saying not to big her up too much because it's not a cure. But I'm gonna big her up anyway. She really is, as Dara says, she's fantastic. She's so welcoming. The whole team there are so welcoming, and there's a great camaraderie because everyone is talking to each other. There's lots of joking going on. So yeah, I've no fear of needles anyway. So I was really looking forward to the treatment, and it has been a success without a doubt. I would get hour and a half long nosebleeds. I would get really, really bad nosebleeds, but my nosebleeds have been reduced to 10-minute nosebleeds, and maybe about, I don't know, maybe two a week or so. I've started to get a couple of nighttime bleeds again. So I'm looking at maybe going back to Madrid in probably June again, but I cannot recommend it highly enough. It's terrible that we don't have it in this country, and HHT Ireland obviously are doing great work to try and get it implemented into Ireland, because it would help a lot of people. But I'll gladly pay the flights and pay for a hotel just to get there. Now HHT Ireland were really, really good, but I'll let Dara discuss that with people in helping us. But I have no qualms at all about paying for flights and going and getting it done again, because as I said, it's the best solution so far that I found. As Saul wanted me to say yesterday, it's not a cure, but it is a temporary alleviation, but it's pretty good.
Thanks, Darren, for that. Thanks a million. Janet, if you want to unmute yourself, would you just like to tell us how you've been getting on since? If you just unmute yourself there, yeah.
And the first 9 weeks have been great. I've started bleeding the back again a bit, but not an hour. Like, I've been bleeding for about 10 minutes, where I would have over an hour, like an hour and a half. Like, I've had loads of transfusions, or iron fusions, I mean. But yeah, I definitely recommend it now. It's definitely given me a lot of relief. I'd go back in a heartbeat, you know.
Okay.
So it's really, I will just give you a bit of hope. Like, when we came out of the hospital, the four of us we were in great form, you know. And we even went to Madrid. We went to the plaza and had a beer. I had one beer. Well, after it, you know. So I would definitely recommend it.
No negative side effects from either of you? No,
nothing like that at all. I was nervous going in, but if I known what it was, it's great now. I won't be nervous going back. I'll be actually looking forward to it.
Okay, and you flew back the same evening. You had the treatment at 9 in the morning, so you went the night before. So you've had the treatment at 9 in the morning, and you were on a plane 9 at night. No problems with flight or pressure.
Yeah. Well,
we were 3 hours.
I was going to say apart from the fact of the storm, but other than that, no.
Yeah. We were 3 hours late from home, but it was grand. Like, we just at the airport, and we were all happy just to have it all over with.
Okay.
And say thanks to Darren and Saoirse and Ida. We had a great time, the four of us.
Yeah.
We're great friends.
Okay.
Yeah.
Well, then, if there's anyone on the floor that wants to ask a question, put your hand up or unmute or whatever, and maybe Darren and Janet can help. Maybe whatever we can do, we can do. Sorry, Mildred, hands up.
Yeah, I'm up here. I'm Dara's sister, Michael's sister, living in Sweden, and we don't have this sclerotherapy in Sweden on offer. So my question is the medical costs. So Dr. Saul's costs and the treatment costs, who pays for that and how much does that cost? Is that expensive, or who covers that?
It's covered under the European health insurance card that we Europeans have. So as Idoia said in her presentation, you don't go without getting your EHIC card. So you apply to the hse.ie to your EHIC, your European health insurance card. And the EHIC card, there where Darren is holding it up, the card allows you for any treatment while abroad for free. So what happens is we do this very discreetly with Dr. Saul. We make through email, we make an appointment and an arrangement, and we meet her at her clinic, and then she walks you down to A&E, and she talks to the right administrators in A&E, and she starts an A&E file on Darren or Janet or whoever has arrived in by quiet appointment. So you don't go in shouting off, you keep low key. So I can put you in touch with Dr. Saul, no problem, and you can manage your own appointment with her. You simply fly over the night before and meet her. And again, Idoia and myself can share the information. But the cost of it, once you have your EHIC card in your back pocket, you don't pay anything. It's covered under the insurance, the European insurance. It says if I went to France in the morning and had to go into A&E with my card, I'd get treated. So it's the same thing. It's just that we haven't knocked on the door directly of A&E. We've gone to Dr. Saul to hold our hand. So we just do it discreetly, but it's all covered once you have your EHIC card.
And A and E, is that emergency when you say A and E?
Sorry, accident and emergency. Yeah,
okay.
Emergency room. Sorry, yeah. Sorry,
Dara,
Darren.
I was just going to say as well, I have some friends in the States, San Francisco, New York, and when I told them all about the European health card, they're all kind of, what? You can go to any country and get treated? Because obviously the the health system they have over there is so bloody, it's just ridiculous.
We don't know.
They're just in awe. Yeah, they're in
We
awe
don't know
of the health system.
how lucky we are. And I know that on screen there today is Sharon there, and Sharon's from up near Carrickfergus, Green Island. And because of Brexit, Sharon now is going to have a problem. So we'll see what we can do. So it's not straightforward. It's within the European Union, anyone with an EHIC card. But Sharon.
I was wondering if you had holiday insurance, and that would cover you probably if you had a bleed and ended up in A&E in Madrid.
Yeah.
That would maybe cover the cost. I would love to go and get my fingers sorted. Absolutely.
And this is it. We think that sclerotherapy can also be used on the face, on the tongues. Sharon has dreadful finger bleeds. They're arterial bleeds that leaves her in A&E, and this is serious stuff. So they've been cauterizing in the north of Ireland boot. So she has a laser appointment now coming up soon, and failing that, then she's going to contact Dr. Saul about the finger. What about your nose, Sharon? Are you thinking you get 2 in 1?
If possible, but I mean, at the minute, my fingers are just like it's 4 times in a week that you're having arterial bleeds and getting ambulance or getting medical help to get you. I mean, I'm losing bucket loads that nobody can. I can't help this myself. I need an extra pair of hands or more to try and sort these out, because it's like a little water pistol that's squirting everywhere.
I'm just wondering, of the people here with us today, does anyone have telangiectasias on their fingertips that causes them problems like Sharon? Like Sharon's are severe problems, but do any of you have the telangiectasias that are pronounced or raised on your fingertips that give you problems? No. A lot of us have them on our face. A lot of us have them on our lips.
I have them on fingers, but gratefully they don't bleed. And every time I see Sharon having an episode,
I'm thinking, oh shit, please don't bleed, because obviously they're very hard to get stopped. And I think, Dara, to be honest, I think these are new. They're not, they haven't always been there, because I don't think I could have missed them before. So it's interesting that it's something that, I mean, I'm 60. I know I look 40, but I'm 60. So this is a new thing for me. I don't know, Sharon, when did yours appear?
I have noticed, I would say, over the last 5 or 6 years, that this one in particular has just been maybe opening a jar or the door, it would just erupt.
Yeah.
And it got so bad that and so many trips to A&E that I actually have all the things to cauterize myself at home. But it's such a wee squirter that I can't physically hold my arm up and get it dried off. I mean, Ian, my husband, is actually using like a cable tie now to try and tourniquet my finger enough to get cauterized at home. But in turn, the constant cautery is just weakening the blood vessels even more. So each week, it's just becoming more and more of a problem, where I think a fortnight ago, it was 4 times in the 1 week. It was just relentless. And you put your hand in a bag, or it's just squish, 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 squish all around the place. And it's frightening at the rate that it comes out at when you're looking that you're filling a bag in like 10 minutes. So I do have, I did have an appointment. The 4th appointment was with laser surgery, which is now happening on the 17th of May. This will be my 4th department that I've seen, because they just keep passing me off to everybody else. They just keep saying, oh, well, I'm not really sure if we're the ones to do that. We'll maybe send you to somebody else, and I don't know enough about your illness, and have you tried this? And again, they just put it down to your finger, that it's just your finger, you know, and it's really trivializing it into something that it's really not. It's not my finger. The last time at A&E, they had to put a massive tourniquet on my bicep and just pump it so tight. The pain was unbearable to get that artery stopped. And like, but it's just a finger.
Yeah. So, well, wouldn't it be good if you could email Sol to ask her if tell her your situation? And as you say, with holiday insurance, if you ended up at A&E at a time that Dr. Sol knew you were coming, it's doable. It's really doable.
I've been 4 years waiting on this laser appointment. So I kicked up a stink last month with my consultant and said, you just have to help me, because this is my independence, it's my work, it's my craft. I can't open a jar. It's seriously affecting my life. And I don't think they literally have a clue. They're just like, they do your bloods, they read your bloods, so yeah, you need infused, you need this. But I don't think they honestly know what you go through. So I gave them a bit of a jolt up the backside, and they did contact Dundonald Hospital for me, and they did bring the appointment forward till the 18th of July. So after the bout of bleeding 2 weeks ago, they've prioritized me as a priority, and they have brought it for. I could have went this Tuesday, only if I've had that quinsy and I'm just recovering from it. So it's booked for the following Tuesday. So toes crossed, not fingers, that this actually,
please God,
goes ahead and somebody doesn't say, do you know what, I really don't know what to do with this. If not, I am going to contact Dr. Saul and go and get it sorted one way or another.
Okay, we'll stay in touch. We'll stay in touch with them, watch this.
Yeah.
Can I ask a question of Darren and Janet? I'm just wondering, the videos weren't that scary, to be honest, but I'm just wondering, what was the feeling? Because obviously your nose from bleeding all the time is very, very you'd be afraid to touch it at all. So when they do all this injecting and you come out of the place, are you bleeding, or are you sore, or are you told not to touch it for 24 hours, or can you sneeze? Can you blow your nose?
No, well, I mean, I can never. I try not to sneeze anyway. I try not to sneeze. I try not to go near my nose most of the time. I mean, other than putting some gel or something up it. But genuinely, afterwards, there was no ill effect. I mean, the only ill effect for about 48 hours afterwards, which will be no different from, in my experience, no different from laser treatment, is that you're bunged up for about 48 hours, and there's just lots of dripping. Your nose is just constantly dripping, and a gauze is placed inside the nose where the injections have happened, and that dissolves obviously over the next 24 or 48 hours. But other than that, no, I had no of it. I can't, Janet will tell you her story, but I had no ill effect afterwards at all. All I had was just purely positive.
Great. Okay, look forward. I'm going out in June, so.
Excellent stuff. Good. Great. Good luck with it.
Thanks, sir. Thanks, Darren.
Can we invite John and Carol to have a wee word? Just wondering how John is feeling. How are you coping with your HHT? And did you go out to Dr. Saul by any chance, John? Were you out?
No, I didn't. I went to my ear, nose and throat specialist in Dublin, and he didn't have enough confidence in it. So we just didn't do it. He obviously didn't know enough about it, but